Hey guys, it's Doc Heps here, and welcome back to UroCoach. So, do you leak when you cough, sneeze, laugh, exercise, and is it driving you nuts? Well, you're not alone. We can help you, so stay tuned how we can improve your quality of life. Hey guys, Doc Heps here. So, the question we're going to go over is, are you having incontinence, leakage, and is it driving you nuts? Well, there's a bunch of different types of incontinence. Today, I'm going to talk a little bit about bladder slings and specifically a type of incontinence called stress urinary incontinence. It's a type of leakage when you cough, sneeze, laugh, get up from a deep chair, exercise, and it can really impede a person's quality of life. Well, there are a lot of things we can do as urologists to try and help you that is outside of surgery. And we'll go over some of these things. We'll go over how we diagnose problems. We'll go over the symptoms. We'll go over the treatment options. And then I'll go over about how I approach each patient towards the end of the video. So I appreciate your time and thanks for watching. So let's first go over what is incontinence. Incontinence of urine is when you leak, when you either have to really go to the bathroom and you can't hold it and a little bit of urine dribbles out, or in a lot of people, both men and women, but more commonly in ladies, they have something called stress urinary incontinence. And that's defined as when there is a pressure on the bladder from the outside. And this is more like when you're lifting something heavy, when you have a big cough or sneeze, when you're exercising, jumping around, and you have incontinence. And so isolated stress urinary incontinence is when you have those symptoms of leak when you laugh, cough, sneeze, and really otherwise when you're relaxed, when you're sitting, you don't feel that urge to go. This is different and distinct from something called urge incontinence or urinary urgency, where all of a sudden you may be sitting there relaxed watching your movie and all of a sudden you get a sudden urge to go and you're like, hey, I got to go right now or I'm going to leak. These are two different components of leakage and incontinence that often coexist, but they're treated differently. So we as urologists try and tease out the worst symptoms that a lady or man may be having, because this will help really guide us as to how best to treat you as the patient. How do we figure this out? Well, one of the ways we diagnose this is by taking history. So if a patient comes in, we'll definitely tease this out. And a lot of it is just asking the right questions. When do you leak? How often? How many pads do you use? Does it occur when you all of a sudden have an urge to go, or is it only with activity? That's one of the key components of figuring out a way to sort of approach and treat. Once we take a good history, then it's the exam. And usually an exam is a mini gynae exam, a pelvic exam where we examine the vagina and tissues to see is there any abnormality, any growth, lump or bump that may be going on that might contribute to your symptoms. Sometimes we'll perform a cystoscopy where we look in the bladder to ensure there's nothing internally inside the bladder that may be causing a problem. And sometimes we'll supplement some testing to better understand how the bladder is functioning. Oftentimes I term the cystoscopy is kind of an anatomic test where we see how the streets are looking, make sure they're aligned right, there's no lumps or bumps in the road. And the urodynamics test, which sometimes we might use in certain patients' case, is kind of how the traffic's moving. So you can have the streets look beautiful, there's no problem, but the traffic's screwy. Other times you can have a lump or bump in the road and the traffic's moving fine. So that's just a metaphor I use to try and describe the test that we use to ensure there's nothing else of concern going on. And these tests help to better understand and ensure that there's no stones in the bladder, there's no cancer in the bladder, and then better tell us how the bladder is functioning. To just circle back a little bit about why a person may get an incontinence. A lot of it could be just genetics. So you may just have a predisposition to having some urinary incontinence. Also, smoking, having kids, estrogen levels, being overweight can all contribute to having urinary incontinence, both urge and stress. Once we take our history and we do an exam, then it's really a discussion of the treatment options. So specifically for stress incontinence, we oftentimes will recommend losing weight, stop smoking, optimize your estrogen status, and pelvic floor physical therapy. These are all fundamental ways that ladies can improve their urinary function. And it may not get you to the point where you're completely dry, but it may improve your symptoms to where you may use minimal pads and it's not such a bother. Some ladies have used sort of internal supports. These are kind of like tampons. They're placed like a tampon and then they kind of deploy in the vagina and cause some compression of the urethra such that it prevents the leakage when you cough, leak, sneeze, laugh, but it doesn't inhibit the normal urination process. And there are different products out there that you can talk to your urologist. And for some ladies, this is perfect. They don't need anything else. There are something called bulking agents, and they're not collagen, but they're kind of in a similar fashion. They're kind of like fillers that we inject into the urethra that basically push the tissue of the urethra together so that the tissue will create enough obstruction so that you don't leak with the cough, laugh, sneeze, but again, not so tight that it won't allow you to void normally. These are called bulking agents. Some of the more common types that are used are called coaptite or macroplasty, and they're used in specific situations for certain ladies. It's again done typically under an anesthesia, but they're not as invasive as what we would talk about as a mid-urethral sling. I'm going to transition to talking about the mid-urethral sling procedure. So conceptually, when ladies leak, when they cough, laugh, sneeze, what we think is happening is there's a natural support system underneath the urethra. And that natural support becomes weakened for different reasons that I mentioned: age, estrogen, genetics, weight loss, childbearing. That natural support typically stays still. And when someone coughs and laughs, there's pressure that's transmitted to the bladder, and that urethra can snap shut if that support system tissue is intact. After time, that support system can weaken and it moves. And what happens is you cough, laugh, sneeze, and the urethra rolls, urine comes out. So what a sling does is it kind of is designed to replicate that natural support. So we as surgeons make a small incision underneath the urethra and place a mesh support such that the urethra will snap shut and urine cannot come out. But it's not so tight that you won't be able to urinate normal. It's finding that sweet spot of pressure against the urethra such that you don't leak when you cough and sneeze, but you're able to just urinate without any press bearing down or straining. So the mid-urethral sling procedure is done under a general anesthesia typically. It takes about 20 minutes of work time, but there's about 10 minutes of just 20 minutes of anesthesia on either end. So I tell ladies it takes about an hour. It's typically an outpatient procedure. You come in that same day and you go home that same day. What we do is we take you back to the operating room. We make a small opening, incision, underneath the urethra in the top part of the vagina. And what we do is we place a little sling to support that urethra where that natural tissue has either weakened or is no longer significantly present. That sling tissue helps support the urethra. And we place it in such a way that it just lies naturally against the urethra. And that's the art of this procedure, really placing it in such a way that it provides enough support, but not too much. We'll put in some dissolving stitches and you go to the recovery. The way I do it is I send you to the recovery with a catheter draining your bladder for about 30 minutes. Once you're awake, you'll go to the second stage of recovery. Your catheter comes out, you'll have something to eat or drink. And typically, if you're urinating okay and you feel good, you get out of Dodge, go home and take it easy. Some urologists will say no lifting more than 20 or 30 pounds for at least a month. At least what I found is about 10 days is sort of a sweet spot where you kind of gradually resume activity after that 10-day time period. Definitely for the first week to 2 weeks, you don't want to do any heavy duty lifting. You want that sling to heal up so that you're not putting any pressure on it. In terms of the overall recuperation, a lot of ladies will use some pain medicine for a night or two. Some ladies can just use ibuprofen and Tylenol. For most, it's not too painful of a procedure. It's just they're a bit sore. Most ladies do quite well. A key things after the procedure, you want to make sure you avoid constipation. So I recommend lots of fluids, stool softeners if need be. You want to avoid any sexual activity for at least a month. And typically most ladies will have some drainage after the procedure. This can be a little bit of bloody drainage from the small incision, and it can last for a day or two. It may last intermittently for a couple of weeks as the dissolving stitches go away. Things to look out for will ensure that you are urinating okay before you leave to go home. But if you have problems urinating, you have to strain to urinate, we have a lot of troubles where you just are bending over or wiggling around to try and empty your bladder. Most commonly, these are transient if they do happen, but you should let your urologist know sooner rather than later. Lastly, if you have fever, chills, pain that's out of control, you're not tolerating your diet, or just feel like something's wrong, then I would have a low threshold to just give us a call. Ultimately, I think it's a great procedure for the right person. It can be fairly transformative in an active lady's life. I think the risks are pretty minimal, and most ladies are very satisfied and very happy. So thanks for listening. Hopefully this provided you some guidance as to the stress, incontinence diagnosis, and some of the options we use as urologists. I appreciate you subscribing to our channel and checking out our other videos. Thanks again.